A blood differential film, it will indicate the numbers of each type of white blood cells. You have, generally for the white blood cells, you have granulocytes and non-granulocytes. For leukocytes, you have the neutrophils, you have the 50 to 70%, you have the eosinophils, which are around 2 to 4%, you have the basophils, which are around 0.5 to 1%, you have the lymphocytes, which are around 20 to 40%, and you have the monocytes, which are around 3 to 8%. These are the figure for the diagrammatic and real white leukocytes. This is another photo showing the different types of white blood cells. Another photo showing the different types of white blood cells. The neutrophils, they also called the polymorph nucleoleucocytes, as we said, 50 to 70%. They have pale cytoplasmic granules that contain lysozymes, enzymes, and bactericides. They are very active first to attack bacteria, engulf pathogen, digest pathogen, release prostaglandins and leukotrienes, and form pus. The eosinophils, also called acidophils, they are 2 to 4% of the total white blood cells. They attack large parasites. They excrete toxic compounds like nitric oxide and cytotoxic enzymes. Its action are sensitive to allergens, control inflammation with enzymes that counteract inflammatory effects of neutrophils and mast cells. Basophils, less than 1% of white blood cells, very small, accumulate in damaged tissue. They release histamine, mainly histamine that dilates a blood vessel, and they release as well heparin that prevents blood clotting. Monocytes, 2 to 8% of white blood cells, large and spherical. They enter the peripheral tissue and become and transform to differentiate to a macrophage. Its action engulf large particle and pathogen, secrete substance that attract immune system cells and fibroblasts to injured areas. In this slide, you can see how you can make a smear of blood film. You need a cover that is touch the slide in angle around 30 to 40. You have a drop of blood, make an adhesion like figure, and then swap the cover to the front. This is the result of the smearing. You can see how the blood is smeared from the initial position. This is another figure representing how you can smear a blood film. This is again another figure to illustrate how you can smear a drop on the slide. Using another slide, you can make adhesion to the blood cell, to the blood drop, and then move forward, not backward. So why is the movement is forward? To avoid hemolysis of the red blood cells. So you have finally in the figure E the smear. This is another figure and the steps of doing the smear. You don't need to study these steps, but you need to be familiar how we do the blood smearing. This is a figure showing abnormal red blood cells. You can see that endocytosis, you have a variation in cell size, and you can see as well variation in cell shape, which is called poikilocytosis, and it's very obvious in the figure. This is a very important slide showing different conditions in RBC's disorder and their related names. You can see how these conditions is related to the name, and you need to study this by heart, so it might be a position for question. So we'll talk now about COM test. What's COM test? Also known as antiglobulin test. Or AGT. It's either of two clinical blood tests used in immunohematology and immunology. You have two types, either direct or indirect. Indirect COM test is used to test the autoimmune hemolytic anemia, that is a condition where the immune system breaks down RBCs leading to anemia. The direct COM test is used to detect the antibodies or complement proteins attached to the RBCs. From the figure you can see blood samples from the patient with immune-mediated hemolytic anemia is taken. So in this blood you can see that the antibody is bound on the surface of the RBCs. So then you removing the patient own plasma and the unbound antibody from the red blood cell. The patient whose washed blood are incubated with anti-human antibodies. So when you incubate the blood taken from the patient with the anti-human antibodies, that's the COMS reagent, you will find that the antibody will cross-link with the antibodies because they are anti-anti. You cross with the antibody on the surface of the blood, leading to agglutination. So the positive test result, it will be like clumping of red blood cells at the bottom of the test tube, and that's mean there is a antibody that is coating the red blood cells. That's the direct antiglobulin test. While indirect is used in prenatal testing of pregnant women and in testing prior to blood transfusion, the test detects antibody against foreign RBCs. In this case, serum is extracted from the blood sample taken from the patient, and the serum is incubated with foreign RBCs, not the same RBCs, of known antigenicity. Finally, the anti-human globulin is added. If agglutination occurs, the indirect test is positive. And from the figure you can see we collected the serum from the pregnant woman, we add the blood, drops of blood. If the antibody bound on the surface of blood, if we put the anti-human antibodies, and it will bound on the on the antibody, causing agglutination, this means a positive test. So what's a negative test will localize? It will localize that the sample will be clear, no agglutination. So if a positive test result, that means there is a cross-reactivity between serum and the blood of another individual, and this test is generally used in blood transfusion. Blood platelets. It is the number of platelets per unit volume, and of course procedures you don't need to study by heart. A platelet count. A platelet count equal number of platelets counted times 400. The normal count is around 150 to 400 times 10 to the power 9 per liter. Medication like oral agent often used to alter or suppress platelet function, like aspirin. Intravenous agents often used to alter suppress platelet function. The disorder leading to a reduced platelet count include thrombocytopenia, idiopathic thrombocytic purpura, drug-induced thrombocytopenia like heparin-induced thrombocytopenia, aplastic anemia, some transfusion reaction, hemolytic uremic syndrome, and chemotherapy. We'll talk now about the coagulation test. So coagulation is a complex process by which blood forms solid clots. Disorder of coagulation can lead to increased risk of bleeding and or clotting. Coagulation involves both cellular, which is the platelets, and the protein, like coagulation factors and components. The coagulation time, it is the time required for blood to coagulate in a glass tube. The prolonged in hemophilia, it is very prolonged, increased in hemophilia and in the presence of obstructive jaundice. Some anemias and leukemias and some of the infectious disease, the time is prolonged as well. This figure shows the three pathways that make up the classical blood coagulation pathway, and this slide is only for knowledge. You don't need to memorize or study by heart. So what is the bleeding time? Bleeding time is a medical test done on someone to assess their platelet function. Diseases that cause prolonged bleeding time include thrombocytopenia. Aspirin and other cyclooxygenase inhibitor, COX inhibitor, can prolong bleeding time significantly. Normal values fall between 2 to 9 minutes depending on the method used. The method actually, a scalpel blade is used to make a stab wound on the underside of the forearm. The time from when the stab wound is made until all bleeding has stopped is measured and is called the bleeding time. Every 30 seconds, filter paper or a paper towel is used to draw off the blood. The test is finished when the bleeding has stopped completely. The TCT or TT, thrombin time or thrombin clotting time, it is the time for the clot formation after exogenous thrombin is added to the citrated plasma. Normally it is used as a therapeutic level of the anticoagulant heparin and for detecting the presence of fibrinogen abnormally. The procedures, you only do one part of blood plus 9 parts of citrate or oxalate. Centrifugation, you have the plasma. The plasma plus the thrombin reagent clot will form. This time is the time between the addition of the thrombin and the clot formation is recorded as the thrombin clotting time. The reference value normally is less than 21 seconds. So if it's more than that, so there is a problem in the clotting time. The abnormal value may result due to heparin therapy, hypofibrinogemia, or fibrinogen abnormality. The PT, the prothrombin time, it's time it takes plasma to clot after the addition of a tissue factor, or the rate at which prothrombin is converted to thrombin in a citrate blood that prevent coagulation with added calcium. BT measure factors like factor 2, 5, 7, and 10, and fibrinogen. Prothrombin ratio. It is the prothrombin time for a patient divided by the result of control plasma. So the reference value is from 12 to 15 seconds. What is the factor that affects these tests? Of course, medication that can affect the action of blood thinners, such as warfarin and vitamin K, which in turn affect the BT result, including antibiotics, aspirin, cimetidine, barbiturates, birth control pills, hormone replacement therapy, and vitamin K supplement. Severe diarrhea is a factor that affects a test as well. Vomiting causes fluid loss and dehydration, which may increase the prothrombin time. If diarrhea is caused by poor absorption of nutrients, vitamins, and minerals from the intestinal tract, malabsorption, BT may increase because of vitamin K deficiency. Foods as well affect that contain potassium, such as beer liver, pork liver, green tea, broccoli, and soya beans products. Excessive use of alcohol, laxatives, and some herbal products or natural remedies. The partial thromboplastin time, normally from 30 to 45 seconds, or sometimes it's called activated partial prothrombin time, is a performance indicator measuring the efficiency or efficacy of both intrinsic and the common coagulation pathway of the coagulation. The phospholipid and activator such as ellagic acid and calcium to reverse the anticoagulant effect of the oxalate, because oxalate do coagulation. These are mixed into the plasma sample. The time is measured until thrombus or clot forms. This testing is performed by medical technologists. The test is termed partial due to the absence of the tissue factor from the reaction mixture. The prolonged APTT may indicate deficiency or abnormality of one of the blood factors or another substance needed for blood clot. A deficiency of one or more of these factors results in a bleeding disorder like hemophilia. As well, it may indicate liver disease, kidney disease, treatment with thinners, blood thinners like heparin, antiphospholipid antibody syndrome, or lupus anticoagulant syndrome that can cause abnormal clotting or blood clotting formation. C-reactive protein. This one of the important protein, one of important plasma protein, is a member of class of acute phase protein produced in its liver from liver as its liver rise dramatically during inflammation. So anybody will have inflammation, the first test will be C-reactive protein. It is thought to assist in complement binding to foreign and damaged cells and enhance phagocytosis, and is used mainly as a marker for inflammation. Thank you.